All right, so I want to talk to you briefly about the methodologies that we use here in the clinic, what we call the Motus Method. Now, this lays out just our basic tenets for treatment. If you think about the way the body works as a whole, we look big picture. That's the only way you get people truly well, especially if you have something that's chronic, that has been there for a long time, that you've been a lot of places for and have no answers. It's probably because we didn't look deep enough and wide enough as far as treatments. So I want you to think about the body in three really distinct systems. Number one, that's your structural system. So think how everything is lined up and moving together, bones and joints and muscle tissue. It's really important, and structure of your body directly dictates how your body functions. Now, the second one is your metabolic health. So metabolics, think everything internal. How are organs working? How are your detox pathways? A big one is, how is your digestive system working? Can you eat food, absorb it, and make new tissues with that? Or does it kind of just pass through? Or maybe you have a lot of GI upset. That's a really big deal if so. And then the last one, and this one's powerful, this is your neurological system. So structure, metabolics, and neurology. Now, your neurological system, I want you to think from the top down. I want you to think about the brain and how it controls and coordinates everything that happens in the body. And we have an impact on that through structure. Every joint gives feedback to the brain, but very specifically through what's called functional neurology, we can impact the way the brain works, how the brain is coordinated between the right half of the brain and the left half of the brain, between what's called your cortex and your cerebellum. They all work together and they have to be balanced. Now those three, so structure, metabolics, and neurology, that's how we get people well. We focus on each one. If there's a deficit in one area, it will affect the other. You can't only do one and expect to fix everything. If we only make dietary change, you're probably gonna get better, but you're not gonna get truly well. If we only adjust you, just do chiropractic, but we don't do the other things, again, you're not gonna be truly fixed and healed. And if we only look at the brain, but you have metabolic deficiencies, or if you have these structural problems, we're going to have limitations still. So you have to do all three. That's my story, that's how I got better, because I didn't just stop. If you heard my story from the video previous, you heard that I did chiropractic really, really well. I did a lot of nutritional strategies, a lot of them. Neither one of those by themselves got me well. It wasn't until we combined both of those with the functional neurology paradigm that I truly experienced healing. And not just to the point of a baseline function, but to where I could truly thrive again. Again, I believe in my heart that people are designed for more. And that is more than getting by, but that is truly thriving. Being the best that we can be, you have to take care of all these problems. That's how it helped me. It's how I've helped thousands of other patients at this point in my career. And it's how we would love to help you as well.